thank you for joining us today. My name is Dr. Tim Mannis. I am a pastoral care counselor at the Center for Ministerial Care. And it's an honor and joy to have a special guest with us today. Dr. Kirstee Williams was so gracious to allow us to come in, film one of her classes on sexual addiction. So it's going to be really, really interesting. Dr. Williams, first, just kind of, if you could, just kind of give the viewers a background on who you are and what led you to Lee University.
Sure. So I came to Lee about 6 years ago and am tenured faculty in the psychology department.
Okay.
I teach mostly in our graduate program, our marriage and family therapy program that we started about 6 years ago. And so that's what I was hired to lead, to come in to do, was to be part of that program. And have absolutely loved it. So I couldn't imagine being anywhere else and really enjoying my time teaching there.
Wow, and you've been there since 2012, is that correct?
Mm-hmm.
Okay, and I have to ask this question because I read your dissertation, by the way. It was extremely good.
Thank you, that's impressive.
It was on the area of marital infidelity. Mm-hmm. What led you to say to yourself, I want to be an expert at this. This is something I want to do for the rest of my life, because
Sure.
I don't know of many people out there in the field that is an expert in this particular area.
Sure. So I think to say that it's a calling is probably one of the strongest elements for me. But when I was in school, I was working a lot with couples, and very quickly realized that I didn't have enough training and knowledge to be dealing with the just overwhelming number of affairs that were coming in to see me. So we had one class, one day on working with infidelity in my grad program. And so, again, recognizing very quickly that I needed a lot more. And so it spun a real interest for me in being able to understand and really try to help couples achieve success. I wanted them to be able to survive something like this. And so anyway, from there, it moved from just focusing on affairs to looking at sex addiction and just sexual health in general. So that's kind of where it started. I really fell in love in working with couples and knew that I needed more training in that area.
Wow, I think it's admirable that you recognized early on this is a passion that you have, and it's certainly something that we need today. Not only are you an expert in this area, but you're also a professional licensed counselor with the state of Tennessee, professor at Lee University, but you're also a woman of faith. You believe in the power of God. And when I look at, when I watch this video that we're about to show here on sexual addiction, I can't help but think, where are we in the church?
Yeah.
How are we doing in this area at addressing which is a very prominent need in society today? I mean, we're bombarded with all kinds of sexual innuendos, and things are kind of being thrown at us all the time. In your opinion, do you think we're doing an adequate job today in the church in addressing these needs?
I think we do an adequate job of trying. I don't know that we do an adequate job of knowing how to actually meet that need. It's very complicated, and I think often things like this are also very shame-provoking, and so we don't know how to really engage in these conversations, and individuals don't know how to engage in these conversations because of level shame they experience. So I think we are attempting, but there's absolutely more that we could do to really try to help and support.
Sure, sure, and that's, to me, that's encouraging. There's always something else that we could do a little bit better in regards to that. But yeah, I agree. I think people are willing and wanting to, but it's just, how do we do that? You said in your video that I think the average age for boys to be introduced to pornography is 13.
Yes.
At that moment, I kind of switched from being a counselor used to be a pastor, and I'm starting thinking as a parent now. We have a lot of younger ministers that may be watching. They've got younger kids. My son actually is 13 years old, and I don't want him to be introduced into pornography, obviously, because we know, well, it's sinful, and we know what damage that does. Is there any advice? Is there anything we can do as parents to help our kids that are growing up in a society that, quite frankly, it's all around them?
It is. And of course, one of the things that we know is such a protective factor is family quality time.
Yeah.
So the less teens are isolated, the more alone time they have, the likely they are to get into more of these high-risk behaviors.
Right.
So monitoring friendships is important, making sure we're filling their time, their free time, with good quality activities. The more family connections that teens have to fall back on and can communicate and ask questions to about some of these things, because very naturally, developmentally, they're at that time of questioning. So the more open conversations and communications, the more protective it is for them not engaging in some of these behaviors.
Absolutely. And so being alone with the iPad,
Yes.
cell phone,
Yes.
Online gaming, probably not the best idea
Yes.
all the time.
Yes.
And when I was growing up, one of the things that we always did is we sit around the table and talk and, how was your day doing? And it was a family kind of activity. And so we kind of have to pull that out of them these days, it seems like.
Yes,
but,
yes.
But you're right. I mean, it's just so, be involved, basically, right?
Yes, yes. The more involved parents are, the less likely teens are going to be isolated to do. And it doesn't mean a teen isn't going to end up, being curious or having friends that might influence
Sure.
in some way. But you want then open lines of communication
Yeah.
to talk about that if that does come up as an issue.
Yeah. And you want them to feel comfortable to
Yes.
kind of discuss these very
Yes.
difficult subjects.
Yes.
It may be uncomfortable for us,
Yes.
but it's good if they're comfortable and they trust you enough to be able to talk about those kind of
Yes.
things. You mentioned the word shame, and a lot of pornography, a lot of sexual addiction is shame-based.
Yes.
And we kind of, as pastors and as ministers of the gospel, we kind of live in a world where reputation is important, our integrity. We'll feel bad over things we shouldn't feel bad over,
Yes,
like
yes.
taking a vacation or taking time off or spending time with our family. And I don't know if you have an answer to this question, but I can't help but think is how do we overcome this stigma of sexual addiction and be able to discuss this with one another and not feel shameful over it? And I don't know if you have any ideas how we kind of approach that. Maybe that's something that as you watch this, maybe we just need more dialogue. Maybe this video will spark a conversation among our pastors, among our members, that this is not something we can ignore any longer. And let's bring this out in the forefront once again.
Yeah.
Before we close, Dr. Williams, is there do you have any words of advice, any words of wisdom for our ministers out there, their families, that might encourage them, that might help them as they move forward into their ministry? Words of nuggets, if you will.
I think one of the things that we see as most important, particularly in areas of leadership, is living with integrity, which means that if we are talking about something,
Right.
Making sure that we are following through in that, and to be an example. And the more we can exemplify Christ, even though it seems like those two don't go together, actually the easier these conversations tend to get.
Yes.
Because we're living with integrity in a way
Yeah.
that's able to model for others who might need extra support and care.
Yeah.
So, yeah.
That's good. And whether we talk about it or not, the sexual addiction, it's there. And so that's wonderful advice. Dr. Williams, I want to thank you so much for allowing us to just completely come into your classroom, set up cameras all over the place, make it a little uncomfortable. But to be able to discuss this, you are in for a treat. You do not want to miss this video by Dr. Kirstee Williams on sexual addiction. You will be blessed, enhanced, and benefited from what you're about to see. I hope that it helps you, and thank you, and God bless.
Lord Jesus, thank you so much for your goodness and your grace to us. Thank you for the opportunity to do something a little unique, and just to look at all the wonderful ways in which you can use us to serve you. We pray for your wisdom. We pray for your Holy Spirit to be present with us in our class. Pray that you will just guide and direct our conversation, that you will open our hearts and minds to whatever it is that you have prepared for us today. And we thank you for loving us in the ways that you do. In your name we pray. Amen. Okay. So we are now shifting gears a little bit, talking about sex addiction and what that means for us as practitioners, what that means for your clients, and understanding the different dynamics connected with that. I think one of the first things that's important for us to understand about sex addiction is that sex addiction, hypersexuality, sexual compulsivity, that all of these aspects are considered to be intimacy and attachment pair bond disorders. Okay? Now, what does that mean? Intimacy disorders. Go ahead.
It's all related to a connection need that is not being met and that people try to fill in other methods?
Yes, exactly, right? This idea that connection is not being met somehow. And what that means, basically, is the idea that individuals sort of live in a fantasy world, okay? And think about that, right? With ongoing pornography use, is pornography fantasy or real? It's fantasy, right? And we know that living in the fantasy is going to produce a much higher high, a much more heightened sense of stimulation than living in the real world. So sex addicts often get to a place where they begin to develop this idea of fantasy and the role that it actually plays in their lives, okay? We'll talk a little bit about abuse and sex addiction and how these things are connected or not connected, depending on the population that we're talking about. And we know that children who come from very abusive backgrounds, right, what are one of the coping strategies that they need in order to deal with life or the reality of life? Fantasy. Right? They have to live in fantasy. That's what disassociation is all about. The idea that I can escape my present reality, right, and move into a different world where I'm not faced with the problems and the stressors and potentially, right, the abuse, if that's what we're talking about, that is going on in my everyday life, okay? So if there's a direct connection between addiction and abuse, and again, we'll talk about some of these things, all right, then we know that fantasy is a huge component of this, okay? Now, imagine with me for a minute, how do you think a couple's relationship is going to do if one spouse is perpetually living in fantasy? Not well, not well. How? Why? Why would they not do well?
The other spouse is going to feel like, or they're going to feel like the other spouse is never fulfilling enough or never meeting their expectations.
Yes, right? The real world, whether it's the spouse in the real world or our everyday lives, can't possibly meet, right, the fantasy world that is going on in my mind and in my head, right? We see almost a similar phenomenon with online gaming, right? The idea, the allure of fantasy, and how people actually get very much caught up in and stuck in this ongoing perpetual fantasy that pulls them away from reality of life, which over time feels very boring, right? It feels very boring to be in the real life when you're perpetually living in fantasy. So the idea that sex addiction then promotes and reinforces an alternate view of self related to the self-concept, okay? If we were to score sex addicts on fantasy scales, they always score extremely high, okay? And like we've been talking about, it's because of this idea that they tend to live in fantasy. All right. The other thing that sex addiction does is that it divorces the sexual response and experience from attachment relationships, okay? So if we're thinking of sex addiction as an attachment issue, okay, as an intimacy issue, my ability to be intimate, my ability to connect, which is sort of counter to the idea that you're using sex, right? It's a way to avoid intimacy for a sex addict rather than a way to increase intimacy. And we'll talk about how that happens and why that's going on a little bit later, okay? But it divorces that sexual response from an intimate connection, right? That relationship attachment underlying. It's really only a physical act. And really in that moment, it's about mood regulation, okay? Okay. The other thing that's important to note about sex addiction and sexuality is that all addicts have a shame-based sexuality. whether we're talking about pornography addiction, whether we're talking about couples dealing with sort of chronic ongoing affairs or whatever area, most individuals who have hyper compulsivity around sexuality, who are truly sex addicts, there is a huge underlying shame base that is consistent with what is going on for them. Why does that make sense?
If you're going from the direction of trauma, we often try to gain a mastery of it. Trauma can instill a sense of shame and low self-worth, so if you have to reenact it over and over again, it gets reinforced by orgasms and everything else, and it's just going to happen over and over and over again, and you're not going to get out.
Yes, and we'll talk about that. There's two different types of sex addiction that we'll talk about. One stemming from trauma, another one stemming from actually early exposure to pornography, so we'll make those connections for you. But yes, right, if ever we have a history of abuse or trauma growing up, we're going to have a sense of shame and guilt about who we are, right? But in general, most addicts, whether again we're talking about sex as drug of choice or we're talking about, cocaine as drug of choice, have a certain level of shame as it relates to their use and abuse of the issue, right? They know they can't control it. They feel out of control. They recognize that there's a problem. Often things that they are engaging in are very disturbing to them. Most addicts will come in, right, with sex addiction and they will tell you, I know that this is not okay. I know that what is going on shouldn't be happening. They're often violating their own moral code of conduct, right? Whether we're dealing with multiple affairs, whether we're dealing with one-night stands, whether we're dealing with excessive pornography use, there is usually, and we struggle with using the word always and never in our field, right? Because there's so much variation in what we do, and human beings, we're not robots. We are very much work often in the gray, but almost always you see this underlying sense of shame for people who are dealing with sex addiction. And as we talked about in relationship with understanding trauma, right? One of the first pieces that we have to begin to unpack is what is the role that shame plays in their sexuality. And obviously for individuals who have experienced and survived abuse, this makes complete sense, right? Why there would be a legacy of shame that follows them as they develop and grow throughout their youth and adolescence and then into adulthood. For others, it can be more complicated, right? That's when we start getting into this idea of how did the sex addiction develop, and we'll talk about some of these categories, okay? But it's important in understanding first this shame piece. The other thing that's important for understanding shame is if we don't get at this shame, how is that going to impact treatment? They'll stay stuck. Excellent. Why would they stay stuck? It limits their ability to move forward. Exactly, right? So the shame sort of gets in the way of their ability to be vulnerable, of their ability to authentically connect, right? Of their ability to utilize therapy in a way that's going to actually propel them forward. Yes, Jamila.
So if they don't see their sexual behaviors as an addiction, will the shame still be there?
Good question. So she's asking if they don't see their sex addiction, right, as an issue, is the shame still present? Absolutely. Because they're operating out of that shame place. It doesn't mean they're willing to address it. There might be certain facets of denial, right, that are limiting them from actually being able or wanting to deal with it. But yes, the shame is still present. And anytime we're dealing with true sex addiction, shame is the underlying force of what is connecting them in the behavior and in the issue. Okay? Yes, Joel.
So in order to prevent any progression from then being reset because of shame, if somebody is making progress, relapses. Mm-hmm. So is it just psychoeducation about shame and then maybe what's going on, or how do you tackle the shame piece?
Good question. What do we do with the shame is what he's asking. So the first piece may include some psychoeducation, helping them understand what shame actually is, the role that shame plays in their addiction, in their recovery, the extent that they feel the shame, right? But then they have to, outside of the awareness piece, they then have to figure out what they're going to do with it. And oftentimes that may mean processing some trauma, right? This is where we start to try to think about when are referrals appropriate and necessary. As we get into dealing, right, with these more central elements of shame, because if it's embedded in trauma, there's one trajectory for treatment, right? If it's embedded in my morals and violation of my morals, right, then there's another trajectory for treatment. So it depends on the role that shame is playing in helping them identify that first. Does that help? Yeah, so that's the important piece. But we as clinicians, practitioners, have to recognize how important that shame is, because it's ultimately the gatekeeper, right, of how much progress they're going to be able to make as they move forward. Great question. Should we always assume shame has not been resolved? The answer to that is yes, okay? Now, again, we can never say always in this profession, but about 99% of clients have a very strong, overwhelming sense of shame that they may not even understand how intense it is or how much of a driving force it is in their sex addiction. But yes, so it is a clinically sound assumption, even though we always want to check the reality of the clients, okay? But yes, our clinical intuition, what we know about sex addiction is absolutely, there is underlying shame pieces connected to that, right? Yes?
Do you determine their level of shame based on how they talk about self-esteem, how they talk about like hiding their behavior, things like that? Does that let you know that they're kind of still stuck with the shame?
How much shame that they feel? Yes. So anytime we feel overwhelming amounts of shame, we're going to feel a lot of secrecy. And we'll talk about some of the relationship dynamics that are very key for couples who struggle with, a partner struggles with sex addiction, or even if both are struggling with sex addiction, right? Pornography use, whatever it is, secrecy is a huge piece of that. So shame is absolutely embedded as part of that secrecy, right? The other thing that you can look for in trying to monitor shame with clients is their visible presentation. Are they looking you in the eyes? Are their heads down? Are they disengaged, right? They're sighing a lot. They're taking a long time to tell you what it is that they've done, right? Those are all manifestations of shame, okay? And so we have to be cognizant of what is happening in the room and recognize and prepare, right? To figure out how do we help them deal with the amount of shame. And again, depending on what community, our belief systems, where we come from, right? All of these things that influence the amount of shame that we're going to carry, right? Okay. So yes, very important. Great questions. Okay. All right. Of course, the other thing that shame does, outside of potentially limiting what they can do in therapy, okay, and how much self-awareness they have about what is going on, is that shame makes sex addicts unable to tolerate intimacy. Now, why would shame make a sex addict be unable to tolerate intimacy? It requires vulnerability, right? And if I am carrying an overwhelming amount of shame about who I am, how I present, what I think, what I'm turned on by, whatever it is, right, which ultimately relates to who I am at the core, right? I don't want anyone to see or hear or know my true self, whatever that means to me. So whenever I'm withholding this level of secret, right, whether it's sex addiction, drug and alcohol addiction, pornography use, affairs, when I'm holding this level of secrecy, right, I don't want anyone to hear or see. And so it limits the ability to be vulnerable, which is why the shame limits intimacy, which is why it can impact your work in therapy, right? And it impacts in profound ways the couple's relationship because it's very surface level, right? I've talked about my clients and the couple that I've been working with where he was having multiple affairs. I mean, so many affairs, right, that couldn't even count the number of affairs, right? And really, if you look at the structure of the relationship between him and his wife, they have an extremely surface level relationship, right? And in conversation with him, really challenging him, there is this whole other side of you that she really ultimately has no idea about. How is that for you? And him being able to talk about, right? It's difficult. Now, he's at a place where he is in pursuit of the divorce. So for them, right, it matters less. But him really recognizing what is this level of shame and how does it relate to his inability to be fully invested in his marriage, right? I think ultimately his decision for divorce is because he believes he cannot be faithful, right? The sex addiction is so overwhelming, he believes he cannot be faithful. And divorce is an easier path, okay? Which is just heartbreaking, right? And we hope for so much more for him. Yes?
Being unable to tolerate intimacy, are we distinguishing physical intimacy between that and like verbal, vulnerable communication, or is it both? Or?
So it's both. Now, sex addicts can have anonymous sex, right? So we have a certain level of physical intimacy that is happening without any cognizant awareness of what is actually going on. There's a certain level of disassociation that can be happening for some, especially if there's trauma history in the background, right? For others, they're not even thinking about it as an intimate thing, right? It's just about physical pleasure. Conversation I was having with my other client, right? The young girl who, again, very much caught up in sort of the sex addiction process and how much she struggled. And she had said, I was asking her a little bit about intimacy and connection when she was engaging in all these sexual, albeit somewhat dangerous encounters. And she was saying, you know, you can have sex without feeling anything. And I said, well, of course, but tell me about what that's like for you, right? And so engaging in all of these sexual encounters without really feeling a sense of anything about what is going on, right? So much disconnection and disassociation, right? There's no intimacy. So we do, to some extent, separate the actual physical act of sex for a sex addict and intimacy as a deeper connection and vulnerability with someone, right? So try getting a sex addict to have breakfast or lunch with someone they actually like, right? It's not going to happen. Why would that be so challenging? You have to be engaged. You have to be vulnerable, right? You have to be interested. You have to share about yourself, right? And when the addiction is so consuming, right? I have no avenue, and remember all of this shame, there's no avenue for me to share any of that with you, right? I know that there's this whole other side of me that you would not love or accept or value in any way, right? And so I'm trapped, right? Ultimately, there really is sort of this sense of being trapped, and that's that piece of being out of control, wanting something more, but having no idea of how to ever get or reach that place, okay? So yes, very much unable to tolerate intimacy because of this. And it makes connecting with someone they actually like incredibly difficult, right? Which is why my client is ultimately choosing divorce over trying to figure out how to connect authentically with his wife. Because he actually likes her, right? He's actually connected to her. He actually, for the first time in his life, thought maybe he could really, truly, genuinely love someone, right? But he knows he can't maintain that. And there's, again, this deeper side of him that she ultimately has no idea about. And the shame is so overwhelming, he can't push through that enough, right? Divorce is an easier option, okay? So yes, very difficult for them to connect with someone they actually like because of that shame. Okay. There are two different types of sex addiction. And again, this is very much recent understanding. Patrick Carnes, who is considered one of the founders and fathers of understanding sex addiction, talked a lot about the addiction cycle and the processes involved in that. We may touch on some of that today. But this comes from more of the recent literature and trying to distinguish and differentiate these two different types of addiction. And the reason it's more recent is you'll see in a second, okay? The first is what we've known for a long time, right? It's called classic sex addiction. This is a trauma-based sex addiction. And often for individuals who present with classic sex addiction, there is this repetition of the trauma that they have experienced in their own lives, right? So if they come from a family background of a lot of abuse, let's say there was a lot of molestation, rape that was going on, often they may have some sort of sex addiction fantasy that involves rape in some way, right? So they find themselves in very dangerous situations, okay, where then they are getting raped, and it's perpetuating, right? It's perpetuating the trauma that they experienced. Now, why would anyone do that? Why would anyone put themselves back in a situation, right, that they were re-experiencing this over and over and over?
Mastery.
A sense of mastery, right? There is something that happens when we experience trauma, right? That we try to gain a sense of mastery over it. So the more I do it, maybe I can conquer it in some way, right? And it becomes a process of almost mood regulation, right, in that moment. And we'll talk more about that in a minute, okay?
Is that a conscious behavior?
Good question. Is it a conscious behavior? Yes and no. So they're conscious in that they are aware of their actions. They are aware of the level of distress. If you ask someone who is repeating a rape from childhood, right, they will tell you it is not a pleasurable experience. Even though they may orgasm, it's not a pleasurable experience. They will tell you that, okay? So they have that level of cognizant awareness, but do they actually understand the driving force that is going on underneath their sexual addiction? Usually not. Usually not. You know, I talked with you about my client, the individual that I was seeing who was struggling with all of these multiple partners, right? Some very dangerous situations that she was getting herself into. And, you know, talking about this idea, is there any way possibly that the rape is connected with any of this that's going on? She had never made those connections before. She had never thought, right, that maybe the rape had such a huge impact in her sexuality, however many years later that it's now showing up as an adult, right? So she knew what she was doing, but she didn't really know what was the motivation underlying cause. Yes. Is early physical abuse, are they likely to grow up and move into physically abusive relationships? We do see a correlation here. It's not a guarantee, but there is a correlation, yes.
And this would also be for the sense of mastery.
I don't know that we would say at that point it's out of a sense of mastery. We would probably think of that more along the lines of this is considered normal, right? So if my self-esteem is so low, this is ultimately the way that feels normal to me to be treated and abused and misused in that way. I don't feel like I deserve more in that interaction. Does that make sense?
Perfect sense.
Yes, yes, okay. So the first type of sex addiction is classic trauma. Okay. The second is what we call contemporary trauma. And this is why this is new thinking on the different types. Because we have seen a huge increase of contemporary sex addiction. This is a new phenomena. Okay. What this is rapid onset, and the predictor of contemporary sex addiction, anyone want to guess? Pornography. Early exposure to pornography. Okay. Yes.
You consider early exposure? Are we talking like a 7 or 8 year old? Or are we talking like 13, 14?
The average age at which boys are usually exposed to pornography is right around, I think, about 12 or 13. For girls, it tends to be a little bit older, about 14 or 15 years of age. That's considered relatively average. If it's any earlier than that, we would say that it's classified as early exposure. Okay, so if you're 10, 9, 8, that's absolutely early exposure. I mean, you can imagine what that would be like for a 6 or 7 year old to try to figure out what is happening. I had a client once tell me he was about, I think, 4 or 5 when he was exposed to pornography and has had a huge porn and sexual compulsivity issue in his adult life, right? For his entire adult life. And he remembers being very, very young when he was exposed. And it was not like a parent was sitting down and showing him pornography, right? He grew up in a fairly conservative home. It was more of this idea of the boys in his neighborhood, right, were watching, the older boys were watching porn, and they would kind of, he was hanging around with his older brothers, and they would kind of get him exposed to all of this, okay? And he remembers being 4 or 5, and he said, you know, I can tell you, I remember it like it's to this day, watching it for the first time, being that little. And he says, the only thing I remember thinking was, why is she screaming? That's all he remembers thinking. Why is she screaming? He could not reconcile in his mind why she looked like she was getting attacked. And so he remembers feeling very confused and afraid and not sure what to do or to reconcile, and he has, in his adult life, has never reconciled that moment, right? So inherently traumatic was that experience for him that he didn't really recognize as trauma initially.
Probably coupled with arousal.
Yes, very much coupled with arousal. And then the older boys making fun of him because it was coupled with arousal, right? So you want to talk about shame, right? He's being humiliated in that moment, right? For something that is relatively normal, right? So yes, huge issues here. So the internet and the development of the internet and online pornography and easy access to online pornography is a sex addict's worst nightmare, okay? And the development, right, that early exposure of sex addiction, okay, and the struggle that is ongoing. Yes, absolutely. It fuels a sex addict's fantasy. Remember, if I live in fantasy, right, okay, pornography is a way to fuel my addiction. It puts fuel to the fire, right? Okay, so it's a way for me to perpetually continue to live in fantasy, all right? So yes, rapid onset and access to the internet. And as we talked about, right, typically early exposure to internet pornography is where we see contemporary sexuality lie in terms of its development. All right, another new way of thinking about sex addiction, outside of looking at it as attachment and pair bonding issues because of shame, because of intimacy, because of the inability to connect, right, is we have started to look at sex addiction as a mood regulation process. Okay? Now, this makes sense, right? Think about this for a minute. Anytime we do something to cope, right, with a stressful situation or a crisis situation, what are we doing in that moment? We're reinforcing behavior, we're regulating our mood, right? I'm feeling stressed, so I need to go for a run. What does the run do for me in terms of mood? It lifts my mood. It releases stress, right? So we engage in behaviors that regulate our mood all the time, right? As parents, okay, we try to interact with our children and helping them learn to regulate their mood, right? If you're mad, we take a deep breath, we count to 4, right? Do this with my 2-year-old all the time, okay? Got songs that we sing about counting to 4, right? We're trying to help them regulate their mood in that moment. Sex addiction is another way to regulate mood, right? If I have trauma, if I have stress, if I have marital conflict, right? If I have self-esteem issues, all of those things can magically disappear in my fantasy, right? And I feel 100,000 times better in that moment, right? Not for long, but in that moment, right? When I get that next high. Okay? And sex addiction is absolutely a process, just like drugs or alcohol, of searching for that next high, right? Because there is a tolerance factor that will start to build, and we'll talk about that piece later, okay? So this is kind of new understanding in thinking about sex addiction, is mood regulation. We know that sex addicts often use sex as a way to alter or regulate their mood, and you will see it for addicts who are in committed relationships, right, who haven't been able to act out, okay, they will start to get grumpy, all right? They're usually very hostile, very angry. We'll talk about some of the relationship dynamics because I don't have access to what I need to feel better, right? Okay? So yes, all right, it's used as a way to regulate my mood, okay? And in this, they will use a particular experience of pleasure over and over and over until it begins to reach the point of tolerance. Now, what is tolerance?
Yes.
Exactly, right? You're able to tolerate that effect, right, more and more, and so you need more of whatever it is, right, to get that same level of high. We see this in sex addiction, okay? So the more I engage in one behavior over a course of time, its ability to make me feel a certain way is going to decrease. Okay? So yes, in sex addiction, we tend to use a particular behavior over and over and over again until we reach a certain level of high. You see this with pornography too, right? People have all different area levels of interest, okay? How many of you saw the most recent news about the Glee star? Did you see that, right? Who committed suicide? What were his charges? Child pornography. We're talking over 600 videos of child porn found on his hard drive, right? He pled guilty for possession of child pornography. Such so much promise, right? So much promise in this young, nice-looking guy, right? Who's got wealth and fame and opportunity, right? But he is absolutely a slave and captive to this addiction process, right? To the point where ultimately he takes his life. He couldn't face the consequences. I think they were getting ready to sentence 5 to 7 years in prison or something like that, right? Prior to what was going on. Can you imagine the shame? It's hard to imagine the shame, right, that he would feel, okay? I would put money on that he did not start his porn career by looking at child pornography. I would bet money on it. Most individuals who end up in inpatient treatment for sex addiction, and there's a lot of good inpatient treatments, which is different than what we do, right? That's very intensive treatment for sex addiction. But most people who end up in inpatient treatment come to treatment because they know that something they are doing is extremely problematic. There's a Center for Healthy Sexuality that's out in Hollywood, California. They deal a lot with individuals who are sex addicts. And there's an MFT, marriage and family therapist, who is on staff there. And she was talking about some of the population, and she said within 1 month, and she said this is high for their population, they don't typically see this, but in 1 month they had 4 men present to their center in extreme distress because every single one of them were viewing child pornography. She said one guy had smashed 4 hard drives out in his backyard for fear of what the consequences were. And she said each one of those 4 men who were showing up in the office, not one of them were pedophiles. Not one of them, right? What is a pedophile?
It's kids.
Someone who is sexually attracted to prepubescent children. Not one of these 4 individuals who showed up in her office, right, had true sexual attraction to prepubescent children. What had happened was an issue of tolerance, right? Throughout their porn careers, they had gotten to a point that they needed more and more and more stimulation to get the same high, right? Just like any other behavioral drug alcohol addiction, we see the same process happening, okay? So yes, there is this period of tolerance because I need more to regulate my mood in that moment. Yes, Travis?
So a lot of studies are showing that porn is becoming more and more violent. So do you think that this is going to cycle either more quickly or have a jump start? Let's say if someone views porn for the first time and it's more violent now than say it was 10 years ago, do you think we're going to lapse into these more extreme cases of pornography use much more quickly?
Absolutely, yes. I think the tolerance will escalate faster, yes. And it's probably one of the most dangerous because one of the justification process I think that tends to happen with pornography is, right, who is this really hurting? Right? That's sort of the question. I'm not actually having an affair. I'm not actually sleeping with someone else, right? I can easily hide all of these issues. So who is it actually hurting, right? That's a very common justification process, right? Embedded within that is the shame. So in order to help understand and process that, right, we have to go back again to this idea of processing the shame. Because most individuals who are involved, these 4 men who we were talking about as examples, right, smashing hard drives, this is so disturbing for them, they check themselves into treatment saying, hey, I've got a problem. They are violating their own moral code of conduct, right? They know that this is not a healthy dynamic. So I would absolutely, my guess is that we would see an escalation of this, yes. Okay. Which of course is hugely concerning in what this means for couples and families and individuals long term, right? Yes.
Is that reportable?
Child pornography is not reportable, no. No, it's not something we can do. It's illegal, but we cannot break confidentiality for it. Yes. We can't guarantee they won't get caught, but it is illegal, yes. It's not reportable though. Okay. And as we've been talking about, right, if this is meant to help regulate my mood, we begin searching for the next high. Okay. the other thing that's important to note is this experience of searching for the next high is also seen with interactions that are shame-based, right? So repeating abuse cycles, right? Individuals who are very stuck in abuse or rape fantasies, right? That these things are often a part of that tolerance buildup as well. And they will repeat this until they need to go on to the next high. And it tends to get more violent and more violent and more violent, right? If I'm not able to work through my past trauma of history and abuse. Okay. And as we've been talking about, they often seek to repeat the abuse as a way to regulate their mood around the trauma. Yes. This is also how fetishes can begin to develop, right? When we have early exposure to all of these issues. And obviously orgasm is a high reinforcer. So we begin to create those neural pathways, right? Of this is what equates to pleasure very, very quickly when orgasm is involved, right? You also then begin to see the development of the paraphilias and the fetishes and things that start to come up in that respect as well, right? I'm turned on by this or this or this, right? There's a process of desensitization that happens, right? Towards fantasy and movement away from relationship-oriented sex, okay? All right, so as we talked about, the internet is really a sex addict's worst nightmare because it perpetuates that environment of fantasy. And if I can dream it and I can think it, it's available, okay? The founder who was talking about the Center for Healthy Sexuality, she was giving a lecture and talking about her experience, and she said, I have a nephew, and I told him my nephew doesn't like raisins, and I told him, well, go and look and see if you can find people on the internet who don't like raisins. And he Googled it, and there's a blog about it, right? She said there was 4 people on the blog, but still, right? There's a blog for people who don't like raisins, okay? Almost anything on the internet we can access. If we can dream it, it's available to us. And so for a sex addict, any fantasy that they want, they can find it, right? So it really is fueling the flame, right, of being able to escape and avoid reality and increase, right, that element of mood regulation in terms of what's happening there. Right? So I have no ability to relate to you relationally, right? But I can go and get my fix independently of you, okay? Which of course blocks any level of our ability to maintain connection. You can think about how difficult and challenging it is for sex addicts who are in long-term relationships, right? Trying to figure out and tolerate intimacy in a way that's going to create any level of healthy connection to their significant other. All right. Of course, the internet provides opportunity for continued and increasing problematic usage, right? Again, anything that we fantasize about, you can access online. So I don't need to drive anywhere. I don't need to go anywhere. I can pull it up right on my phone, right? Client that I was talking about earlier, he was saying, this was the guy who had early exposure to pornography and then such huge complications later on in his adolescent and young adult and then adult life. And he was saying, it's so easy. I mean, I can take a block, I can take a walk around the block at work and I've got my phone. So he was viewing pornography almost 24 hours a day to the point where he could be looking at it and he's not even aroused by what he was seeing, right? It was just sort of, it's there, okay, right? There is an absolutely huge addiction process that is happening in that moment, right? Okay. If you need anything to help you feel normal, we have an issue of addiction. It doesn't matter if it's ice cream. It doesn't matter if it's French fries. It doesn't matter if it's sex or if it's cocaine, right? If we need anything to feel normal, we then have an issue with addiction. Yes, Travis.
One of the big contentions in the chemical dependency is that addiction to alcohol is different than addiction to illicit substances because it's legal and you can get it pretty much everywhere and everybody uses it. How would you then compare pornography use to that, because I would argue it's more prolific than that.
Than even
Than
alcohol use.
Yeah. So would you say that this is even harder to treat than alcohol because it's even more widely available?
Oh, it's incredibly difficult to treat. Incredibly difficult to treat. There is differing levels of tolerance and addiction processes in place, right? So one addict's addiction, right, is different than someone else's compulsive use. Does that make sense? So there's differing levels of this. And it can be hard in clinical work to differentiate between those processes, right? Trying to figure out, are we dealing with true addiction? Are we dealing with hypersexuality? Are we dealing with sexual compulsivity? What actually are we dealing with, right? If you've got a client who's had 3 affairs and you're like, well, is this sex addiction? Is this compulsivity? What is actually going on? It can be difficult to differentiate, right? But it's the dependence piece that we try to pull out for addiction, right? What is the issue of tolerance? What is the issue of dependence? We'll talk about characteristics for trying to understand trying to diagnose pornography addiction. So we'll get there. But yes, it's challenging. I think people who are addicted oftentimes argue that they are not. And so they will say, well, I just use it, right? It just helps me feel better. It's just quick, right? And I only use it, right, 4 times a week. I'm not using it every day. There's 1-2 days of the week that I don't utilize porn, right? I only need it to go to sleep at night, right? And I've had conversations with clients. I only use it, right, when I'm stressed out. I don't need it any other time. So at that point, we would begin to argue, right? We probably have something bigger than compulsive sexuality. Being able to admit that you have an addiction is very difficult when I have so much shame. Absolutely. It's why denial is so central in that process. I think the challenging thing with moving beyond sex addiction or pornography addiction or anything else that we might be talking about or dealing with is there's an aspect of that requires celibacy. Most addiction recovery processes require celibacy as part of that process, right? So we're no longer acting out, we're no longer engaging in a trigger behavior until I have a different way to regulate my mood, right? So if I'm a cocaine addict, I'm not going to use marijuana, right? There's typically a period of abstinence that is going on in those interactions, right? It's the same with sex addiction, but that's extremely challenging if sex is the only way I've ever learned how to regulate my mood. And how do we help them maintain abstinence? How do we know that you are truly maintaining abstinence, right? Unless you're locked up in a cage somewhere, right? It's extremely challenging.
How do you take away the internet from somebody who's addicted to pornography?
Right, and you can't. And this is what couples often end up going through, right? How do I know that I can trust you're not going to do it again when you can access it on your phone, right? When we have, and so they end up moving the computer in the living room and we're trying to set up some boundaries that might potentially help, right, with some of that. But yes, it's a huge issue. It's a huge issue, okay? So yes, very difficult, okay? And as we've talked about, right, as in the case with the Glee star who ended up committing suicide, most individuals who are viewing illegal pornography did not start with this. Okay? It usually starts off very simplistic and very innocent in those early interactions. Okay? Now, there's typically continued engagement, right? Individuals who may have been exposed to porn but don't utilize it for a year or two and then fall back, right, for a period of time and then stop utilizing it, right? That's different than really the dynamic we're talking about in terms of tolerance, okay? That's probably going to hold tolerance a lot longer, right? That stop-start approach, does that make sense? Because I'm not going to build up as quickly. But if I'm utilizing it consistently, right, I'm going to build tolerance a lot faster. Does that make sense? Okay. But we don't typically start off this way. And again, as we mentioned, as we build up tolerance, we then are seeking that higher high, just like we get with drugs, right? You need more in order to feel something in the same way that you did, okay, as in the past. The other thing that's important to note, for individuals, right, she was saying with those 4 men that came into her inpatient treatment and with this star who committed suicide, we would put money on the fact that they are not pedophiles. They're not truly, right, attracted to prepubescent children, right? This is a process of tolerance. Over time, they got to that point of needing riskier and riskier, right, interactions, okay, in order to get that same high. And they are often disturbed by this behavior, okay? People show up knowing that something is off, right? This is not okay. I know that this is not okay, and I need help because I recognize that this behavior is problematic, okay? All right, so let's talk about some myths and then some truths about the development of sex addiction and abuse, okay? There's a myth that sort of goes around in understanding sex addiction that anytime someone has a history of sexual abuse, there's a connection to the development of sex addiction. This is not true. Now, it doesn't mean individuals who have a history of abuse, remember we have classic sex addiction, it doesn't mean they don't develop sex addiction. You can. So a history of abuse can be connected to the development of sex addiction, but it is not the only reason. There are other reasons people can fall into, right, the sex addiction process, okay? So there's a myth. And Patrick Carnes, who I told you earlier, who's kind of considered one of the founding fathers of sex addiction, he did some research early on, and he found that for women who suffered from sex addiction, 63% of them had a history of sexual abuse, okay? Which was a higher percentage for women than was for men. Anyone want to guess how many men had a history of sexual abuse? Good guess? It's a lot lower. 39%. Only 39% of men had a sexual abuse past, okay, but were sex addicts. So while we know that there are some correlations and some connections between sex addiction and sexual abuse, it is not one of the primary issues in the development of sex addiction. And it's important, I think, for us to understand that, right? Because it's not something that we necessarily need to track all the time. So anyone want to take a guess of what is the primary? Early exposure to, for contemporary sex addiction, yes. Okay, but in the overarching category of sex addiction, no. Although there's correlations between early exposure and this. Attachment injuries, good, which equate to emotional abuse, right? Remember, we now have new thinking about sex addiction. This is a pair bond attachment issue, right? I can't be vulnerable, I can't do intimacy, I can't connect. There has to be ruptures in the attachment somewhere. About 97 to 99% of individuals who truly have sex addiction will report coming from an emotionally abusive background. Okay? So it's not sexual abuse, it's not physical abuse, but emotional abuse, right, equates to low self-esteem, a lot of shame about who I am, right? A lot of fantasy play, right? If I am having to escape, right, feeling stupid or unworthy or unloved or unwanted, right? I'm going to move into fantasy, okay? So there is a high connection and correlation between emotional abuse, okay, and sex addiction, right? And the stats that we have about that, I think I put them up here, about 97% of individuals report emotional abuse, okay? Shame, degradation, neglect, right? And you can see it, right? You can see how sex can become a way to try to repair that. Even though I can't do vulnerability, even though I can't do intimacy, even though I can't do true connection, sex is a physical way to try to somehow gain mastery and repair that, right? When in actuality, what am I doing instead? I'm only hindering the development of that, right? I'm not actually going to be able to repair anything in me. I'm only continuing to harm me. Oh, interesting. So you're asking me, those who choose to participate in porn, is there a higher incident of them having abuse in their history? We don't know that. There are a lot of female pornography stars who argue that they do it for the money, that they do it, they did not come from abusive backgrounds, and they are very clear, I wasn't abused, and yet I chose to go into this industry, I would argue that it's probably a highly emotionally abusive environment that they went in, that they come from, even if there was no sexual or physical abuse. Well, anything that can rupture attachment, whether it's real or even perceived, right, could potentially rupture attachment. And so if they experience it as emotional abuse, and it fuels feelings of shame and self-loathing and self-disrespect and self-esteem, all of those are contributing factors to the development of sex addiction. Yes, so you can have an attachment injury that comes up and ruptures a primary attachment relationship at any stage of the developmental life cycle. Yes, yes. But certain ruptures are going to have a bigger impact than others. And earlier on in our childhood, it's going to have a bigger impact than if I'm an adult and having a different and new experience that I wasn't used to. Yes. Mm-hmm. Okay. All right. So as we've been talking about, right, the idea that attachment is so central and foundational is really important for us to understand as we think about working with clients and diagnosing clients and figuring out what is going on. Okay. As we know, pornography provides for sexual arousal, climax, and resolution without real relationship attentiveness or responsiveness. And attentiveness and responsiveness are the key dimensions to attachment, right? In sexuality. If I'm non-responsive, if I'm not attentive, right? Doesn't mean much in those interactions, okay? And what's interesting about this, right? In this fantasy where I can have sexual arousal and I can get to the point of climax and resolution without any relationship connectedness, right? It impacts my brain's ability to process what is going on and to connect with people in real life sex. Okay? So how we know this is when we begin to look at some of the differences between dopamine and oxytocin. Okay? Dopamine is released in the brain. Dopamine is a feel-good chemical, right? It gives us a high, all right? And we know that there are synthetic things that we utilize that can give us a dopamine rush, right? Anything that we find pleasurable is going to give us a dopamine rush. Pornography gives a dopamine rush without oxytocin. What is oxytocin? Oxytocin is a cuddle hormone. It is the bonding hormone, right? So mothers release it when we rock and hold infants. Mothers release it when they breastfeed. When a couple engages in relationship-oriented, intimacy-based sex, they release oxytocin. But oxytocin is not released in solo sex. Oxytocin is not released when individuals masturbate to pornography. Okay? Oxytocin is only released in relationship when we are actually physically connecting with someone else. And so we get a high rush of dopamine, right, with pornography use, but no release of oxytocin. So it allows me to have a high without any level of relationship connection that is going on. Now, what happens if neural pathways then over time are built up and built up and built up, right? And I'm releasing just dopamine. What happens?
It gets less sensitive to the dopamine. It doesn't look for the oxytocin.
It gets less sensitive to the dopamine, so I need more for the same high, and it doesn't look for the oxytocin, which is why individuals who have a long history of pornography use show up and they can no longer perform, right, in relationship-oriented sex. So now they have trouble, right? They're not turned on. Their body is not responding in the way that they want it to respond, right? Because all they've done is create the connections between the dopamine and the pornography, right? So your body stops responding essentially to what it's not getting in that moment, okay? And so now I'm really struggling. I find relational sex very boring, and I don't know how to engage, and my body's not working like it's supposed to work, and I have to close my eyes really tight and fantasize in order to even get anything to happen, right? It's interesting. Over the course of the years that I've been practicing, I have seen younger and younger couples coming to me who should have no physical issues. They've been married maybe 1, 2, 3 years, right? Healthy, strong, right? Attractive. There's no reason that they should be having problems in the bedroom. And yet they show up because guess what? Parts aren't working in the way that they should be. One of the number one questions I ask is what?
Are you watching porn?
Are you watching porn? Right? Porn is one of the number one indicators for sexual performance issues early on without some of the physical stuff, right? That might be showing up later in life. Okay, for healthy young individuals, we always need to assess for pornography use because it diminishes, right, our ability to stay in what is normal, right? My body's not responding. It feels boring and disinteresting and, you know, I'm not turned on by this. I'm not turned on by this because it doesn't reach the high that fantasy reaches with pornography. Does that make sense? So it's really important to assess that, right, when you see some of these issues going on early on. Yes, Jamelia?
What would treatment look like if they're having issues because of porn usage? I mean, obviously they would need to stop the fantasy, but like, how would you move forward with that to have them re-engage with sex again?
Okay, great question. So she's asking, well, how would you help a couple then in that sense? There's all kinds of different processes we could potentially use, but ultimately the goal, right, is obviously the porn has to stop. Any amount of continued porn use is going to fuel that fantasy and detract from one's ability to engage relationally, okay? So obviously that's first and foremost, and that can be a process in and of itself, depending on the level of dependency, depending on what's going on, the willingness, the motivation relationally, right? Those things can be challenging. So that's the first goal, is to stop the porn use completely. It cannot continue. So that's one. The second piece then is a process of learning how to be intimate, right? Most individuals who have a high pornography use to the point where it's affecting relationship struggle with intimacy. So intimate sex feels, it's very anxiety provoking, it's very confronting, can't engage in intimate sex, right? So then we've got to start with the vulnerability and helping them deepen those relational connections before they can move into different types of sex. Recognizing it's going to take time to retrain their body and their brain. They've been training their body and their brain one way, right, with the porn. It's going to take time to retrain your brain and your body to respond to relational sex, but it's doable. It's the beautiful thing about, you know, the plasticity of our brain, right? That it can do that, but it takes time.
So would you do sensei with a situation like that?
Would you use sensate focus work if there's enough anxiety? Yes. That might help with that process. Yes. Yes, emotional connection, intimacy, vulnerability, right? Those attachment building blocks.
So like EFT would work?
Yes, beautifully. Yep. Yes. Okay. All right. So then how do we go about, in the last few minutes here that we have, how do we go about identifying pornography addiction? Of course, one of the first things that we try to understand is what is the pornography doing, right, for the individual? Are they viewing porn as a way to cope with stress, right? Is it a way to alter mood? Okay, that's one of the first indicators that we are dealing with something more serious. Okay. Second, the individual who is viewing pornography is participating in activities that would not be otherwise engaged in, such as paraphilias, due to viewing the pornography, right? So then the fantasy life that I'm creating in my porn is translating, right, into my real life and my desire to perpetuate the fantasy life. So then I'm starting to involve myself in things that I typically otherwise would not have done, okay? Third, the hour limit here, spending more than 11 hours per week viewing pornographic material. To be honest, I'm not sure where that 11 hours came from. Yep, I knew that was coming up. Not sure where that came from, but that is the distinguishable factor. And whether that has to do with tolerance and build-up dependency, probably all of those issues, right? It's 11 hours, okay?
So 10:59, I'm doing good.
I guess so, 10:59, I guess. So spending more than 11 hours per week viewing pornographic material, and this is different than sexual compulsivity. You can have sexual compulsivity without addiction, right? This is how to identify addiction, the issue of dependency, right? So you can be utilizing porn in an unhealthy way, even if it's less than 11 hours per week, right?
Distinguish a treatment for compulsivity and addiction?
Not really. It depends on the level of compulsivity that we're dealing with. So he asked if there was a distinction in treatment. Part of it would be having to understand what is going on with the client and why they are utilizing the porn, right? If there's a mood regulation piece, we have to understand that piece, coping, all of shame, all of those sorts of things that we've been talking about, okay? All right, of course, tolerance, right, as that relates to addiction, the buildup, needing more and more stimulation. Okay, and withdraw, right? So if I can't engage in the behaviors, right, then I become grumpy and agitated and angry and frustrated. And it's interesting that sort of the relational dynamic of individuals who have pornography addiction or sex addiction, they're often very grumpy people. And you're grumpy, right, because you want to live in a fantasy and you're forced from time to time to have to be in reality, and reality is terrible, right? I don't want to have to deal with this, okay? So there's a lot of hostility that tends to come up in the withdrawal process.
It seems that a lot of these criteria would be difficult to be observed, especially since something like pornography viewing is done mostly in secrecy. So we're then relying on people to self-report
Yes.
if they have these behaviors,
Yes.
which touches on that shame aspect.
Yes.
Are they going to?
Yes.
So then, even with this criteria, it's probably very underreported.
Oh, I would say it's extremely underreported because of the shame. But we can only work with what clients bring us. So the stronger relationship that we have, the more authentic and honest we hope that they are. But yes, we can only work with what they bring us.
It seems difficult. Somebody who's dealing with such a strong shame piece attached to
Yes.
pornography addiction, being able
Yes.
to check off these boxes on
Yes.
a questionnaire saying, oh yeah, yep, that's me.
Yes, which is typically why we don't start with this in therapy, right? You're not going to do an assessment of pornography addiction until you have a rapport, right? A strong relationship with a client to feel like, okay, so I feel like I'm missing something in understanding what you're describing to me. Can we talk more about this or unpack this piece? Yeah. Okay. All right. So what is the impact on couple relationships? Of course, one of the things that we're going to be dealing with, whether it's, let's say we've had 2, 3, 4 affairs, or sex addiction where there's so many that they can't even count or remember, or we have ongoing secrecy around pornography use that's found out from time to time, one of the primary issues we're going to deal with is trust, right? Most couples who have a history of pornography addiction, sex addiction, most committed marital relationships don't distinguish between the two, right? If you ask there's a study done looking at wives' experiences of husbands' pornography use. So no actual physical relationship outside the committed marital relationship, but their experience of their husband's pornography use was absolutely the same post-traumatic stress disorder-like response you see in affairs. Okay, so they were having the same reactions and responses to the secret porn use as they were having to the idea that their husband had actually been unfaithful with someone else. So we know that there's significant trust issues that come up, right? Are you doing what you say you're doing? Can I actually trust you? How do we manage that when you can access the internet at all these times, right? I have no idea how to even know if what you're telling me is true. So huge issues there. And it's also important to note that when we're dealing with sex addicts or pornography addicts, they often look antisocial in relationships. They look antisocial because they're lying, right? There's all the secrecy, they're stealing, they're gaslighting, they're hostile, they're angry, right? They look very antisocial in presentation, even though they're not truly antisocial, right? They're addicts. Okay, they're very self-absorbed, very self-focused. It doesn't matter what's going on with you. I only am focused on getting my next high, right? So in presentation, they can look very antisocial. And as we said, typically very irritable and angry, okay? Of course, this is because I struggle to regulate my mood without the addictive behavior. And if I'm in a committed relationship, I feel the stress and pressure and tension of not being able to act out. Right? Or trying to act out and then keeping it a secret and having to hold that secret, right? Which is extremely stressful in and of itself. So there's a lot of struggle around being able to regulate my mood because I'm not able to do that through relationship. Of course, the emotional and cognitive effects, you see because of the shame, there's a lot of self-esteem. They're very inadequate as relational partners, okay? So there's a lot of hostility and inadequacy that is going on there. Whether it's inadequacy, I mean, you could imagine the struggle, right? Not being able to perform in bed, and yet knowing this is sort of the secret life of what is going on for you, and the dissonance that would be cognitively for someone, right? Okay. Of course, secrecy, and as we've talked about, whether it's affairs or whether it's sex addiction or whether it's pornography use, it thrives in isolation. It thrives in secrecy. If none of this is a secret, right, we have a much easier time healing and processing and moving forward. And so, of course, healing is going to look at how do we open up the secret to be able to unpack that in a way that's going to help, right, deal with what is going on. But it thrives in isolation, right? When I don't have to think about you, I can interact, right, and do what I need to do without having to pay any of the consequences of what's going on. Communication problems, if I'm lying, if I'm secretive, right, if I'm angry, we're going to have communication issues. Okay. Problematic interactions, right? Again, you see the same thing, right? Not being able to connect, not being able to be intimate, not being able to parent, right? Not being able to do all these other the realities of life, right? Become very difficult if I constantly live in fantasy, all right? And then these last few pieces as we wrap up here, very much, of course, addiction is seen in egocentrism, the focus on self, and it's not necessarily because they are egocentric, but if I'm addicted, right, the addiction is paramount in my life. Even though I may care about you, I don't know how to put you first. Okay, so very egocentric, narcissistic in that. And because of this, it promotes that sense of narcissistic thinking, where relationship orientation, so the idea of turning towards your partner, being relationally oriented, is preoccupied with personal gratification, which of course limits the ability to be responsive and to engage, right, in any given way. So I hope this was helpful in understanding some of the aspects of sex addiction and how to unpack that, and looking at how this relates to couples as they try to figure out and move forward what